If you are a woman who is pregnant, is about to become pregnant, or has just had a baby and you like fitness, you love moving, you love exercise, this video is for you. I've got some really awesome special guests on today's episode that are going to talk to you about postpartum and pregnancy training that's going to help you elevate your game and stay moving. What's up, everybody? Welcome back to another episode of Excellence in Motion. My name is Caden, and I'm here to inspire you to achieve your potential through movement. If you're new to the channel, I do videos on movement tips, gear reviews, and health education. So if that stuff interests you, make sure you hit that subscribe button down below so that you can get notified every single time that there's a new video that drops each week. So just like the intro suggested, if you're somebody who is pregnant, is about to become pregnant, or has just had a baby, this video is really going to dive into the training philosophies surrounding being pregnant and what are the things that you can do to help move your training forward while you're pregnant, or recover from your pregnancy so that you're setting yourself up for success afterwards. In a couple of minutes, you're gonna see some clips from a couple of ladies from Restore Your Core PT in Indiana talking about pelvic floor therapy specifically as it relates to women who are postpartum or pregnant and are trying to compete or work out in CrossFit or any other sort of fitness regimen. These ladies are a lot more advanced in this type of information than I am, and I love being able to showcase what other people know that I believe can be really helpful to my own audience, and I'm really excited to see what your reaction is to this and if the information that they present is going to be really helpful for you. Amy and Julia, the doctors of physical therapy with Restore Your Core PT, sort of fill our coaching staff in on some of these pieces and give us some background information for what this stuff is and how pelvic floor physical therapy can help. And I'm hoping that by listening to them talk, you guys can learn a little bit more about pelvic floor physical therapy as well, so that if you're someone who needs to get back into training and you fit any of these three categories related to pregnancy, you can find a pelvic floor physical therapist near you and have them help you get ready to move back into training.
Start by saying I think it's really important that you guys understand our job as physical therapists is to keep people coming into the gym throughout their entire pregnancy and postpartum, but keeping them safe and really helping them to learn how to make the appropriate modifications to get back to doing the things that they love to do and want to do over time. We don't want to take people out of exercise. We want to keep them exercising throughout the duration, always. And so I know in the US, there's kind of been some push-pull between physical therapists and personal trainers, and feeling like if I refer to a physical therapist, then we may not get those patients back, or they may take us out of the exercise program. We don't want to do that. That's not our goal. Our goal is to keep people coming in, and especially if you have male clients that their wives maybe aren't coming in here. Our job when maybe their wife is trying to get pregnant, we want them to come in as a couple to be able to work out. Because the stronger a woman is during her pregnancy, she's going to be more apt to have a better delivery. And she is going to be more apt to not have injuries with lifting the baby and lifting strollers and working out when she has the baby.
And I know I'm in the stage where a lot of my friends are getting pregnant, and they all say, I say, okay, do you have any questions? They're like, well, I already backed up on everything. And I'm like, no. Like, that's not the answer. The answer is to do it safely and keep yourself as active and healthy as possible, versus just saying, oh no, I'm just gonna only go do yoga and walking now, which is the answer I get from so many of my friends. And I'm like, no, we wanna keep you lifting. We wanna keep you doing all the things you love, keep you in the community that you're used to so you're supported throughout the entire journey. Yes, it's going to look a little bit different than what you were doing beforehand, but keeping with what you were doing is so important to maintain your muscle mass and your strength as you're going to be lifting a little one and all the things that come with a small baby and that.
If I had to ask you guys what is a pelvic floor physical therapist, or a women's health physical therapist, or a men's health physical therapist, what would you guys tell me?
I did not know you guys existed until a different CrossFitter reached out to me and told me about you. So I didn't know such a thing existed. And when I think pelvic floor, the only thing I thought about was peeing during double unders. Women who pee during double unders. That's all I thought. That was the extent of my knowledge.
I have no idea.
Yeah. So the inner core is made up of your transverse abdominis, your breathing diaphragm, your pelvic floor muscles, and your multifidus muscles. And so with those 4 muscle groups, all of those muscles work together synergistically, right? And so our breathing diaphragm needs to be stacked over the pelvic floor in order for the whole inner core system to work well. And so during pregnancy, the abdominal wall gets really stretched out. A lot of women end up with diastasis recti.
It's the separation of the rectus abdominis. As the baby grows, the abdominal wall stretches, and that linea alba is actually made to stretch naturally. And most women on your 3rd trimester will have some sort of separation in that abdominal wall. But then postpartum, it should naturally come back together, and there's a subsection of women that it doesn't, right? And so then we get even more core dysfunction on top of that, which we'll go into a little bit more. But on top of the diastasis recti, postural changes during pregnancy are huge, right? And so Amy was talking about how the diaphragm works with the pelvic floor and the abdominal wall and the back muscles. And so as baby starts to grow, we start to have these postural changes which disconnects the top and the bottom of the inner core.
And when you lean back, this is what naturally happens during pregnancy to counterbalance the weight of the belly. You'll notice that you breathe more with your upper chest when you are slightly shifted backward, okay? It puts more pressure on your low back, so a lot of pregnant women have low back pain, right? And it takes the synergy between the breathing diaphragm and the pelvic floor out of play. And during pregnancy, we work really hard on shifting that posture into a more natural balance. So that, number one, it takes pressure off the abdominal wall, because even during pregnancy, if they have a diastasis and say they're lifting heavy and you can see like a bulge down the middle of their stomach, it's a pressure management issue. And those are things that we help them learn how to manage during their pregnancy, so that hopefully their diastasis does not get any worse. It's a naturally occurring thing, but imagine if you're hanging out here all day long and you've got the baby growing. You can actually, I've seen women have an 8-finger, so 8 fingers diastasis, right, afterwards. And she actually rehabbed very well down to 1.5 to 2 finger widths, which is considered normal. So there are lots of things that we can do to help with that and to decrease urinary leaking. So I'm just curious, how many people think it's normal to leak urine after you have babies? Just raise.
If you were to ask that to a 9 a.m. group of our moms,
Yeah.
everyone, a lot of people would raise their hand.
Yeah. And a lot of people, a lot of people think it's normal. But, and we have people say all the time, well, my mom leaked, or my sister leaks, or my friends leak, and so, you just have to leak after you have children. And that is not true. There are so many things, and usually leaking is a sign of a pressure management problem.
So when we breathe, right, we can either hold our breath, right, and we create a massive amount of intra-abdominal pressure called a Valsalva, right, and a lot of women tend to hold their breath, right, when they lift or when we lift heavy, which creates this amount of pressure in the abdominal wall and in the core cavity, right, which puts pressure on your abdomen, pressure on your pelvic organs, which puts us at risk for a lot of things like leakage and prolapse and diastasis recti and pain, right? And so we can teach people how to manage pressure better.
So the next question, if I had to ask people where their pelvic floor was at other than you, where is your pelvic floor? Like, where would you point? Where is your pelvic floor? Yeah, so you're sitting on your pelvic floor right now, right? You're sitting on it. And so a lot of women will point to their stomach, and that's because when you contract your pelvic floor, the transverse abdominis should co-contract along with the tiny little multifidus muscles in your back, right? And so when we exhale, synergistically, the pelvic floor contracts, the transverse abdominis contracts, the multifidus contracts, okay? And so most people aren't familiar with the pelvic floor. This is a female, but the male pelvic floor actually looks quite similar, believe it or not, okay? And so we have 3 layers to the pelvic floor. So I think this is always a really great place to start, because who teaches us about the pelvic floor? Really nobody. And so, basically the first layer can be felt directly through the skin. Partially the second layer can too. And then inside, we have a 3rd layer, and the only way to truly access this layer of the pelvic floor is to do an internal pelvic or rectal examination. But for us, you can do a little bit of external palpation, but even at a CrossFit gym, people aren't going to be real comfortable with that. And it's not always accurate. It doesn't always translate, because for us, we can actually palpate vaginally And you can feel that pressure if it's off. You can feel that pressure coming down into the finger, which puts women at risk for prolapse. I don't mind sharing, I have prolapse myself, and you can manage it. I still work out, I jog, I run, I lift heavy, I do all of those things. I just know how to manage the pressure. And so our job is to help women figure that out so they can continue to do what they love to do. Because something as simple as, a big problem, you guys have probably heard, rib dysfunction during pregnancy, because the baby kind of pushes up under the rib cage and it affects the breathing diaphragm and it affects the ribs. Well, that in turn then can affect the transverse abdominis, the pelvic floor, right? And so that's why first and foremost we are orthopedic physical therapists before we are pelvic floor physical therapists. So when we do look at patients, we look at the entire body. It's not a one and done. They're not coming in just doing Kegels. Let's be clear, because everybody knows Kegels. Kegels, if they worked, everyone would do them, right? But a lot of times the reason they don't work is because people are holding their pelvic floor super tight. They're always holding. So if you hold all the time, then we have to teach people how to relax the pelvic floor before they actually learn to strengthen it.
Yeah, I feel like as coaches, we probably should assess who's in our classes and stuff, so that we can, if it is like a back squat or a front squat or a heavy deadlift or whatnot for the day, you're welcome, is that we go up to them and ask them, how do you feel? I'm not going to ask one of them if they're leaking, so. But I just ask them how they feel, and maybe give them an assessment of breathing right off the bat, and then keep a good solid eagle eye on them. And then if they're struggling, or if it's starting to get their technique's starting to get a little wonky or whatnot, that we can reassess later. Okay.
The thing I'll mention, especially pregnant, weightlifting was not that big of an issue. I feel like a lot of our people, when you're pregnant, I'm not doing 1 reps, right?
Right.
You're just doing higher rep schemes. It was more of the jumping type of stuff that I think, and core stuff, that I think our pregnant women are coming to the coaches saying, okay, what do I do instead of toes to bar? Or what do I do instead of jump rope?
We actually want to prepare their inner core for postpartum. We want them to be able to connect with that diaphragm, that pelvic floor, that transverse abdominis earlier on, so that when they're postpartum, they have an easier time reconnecting to that system.
We actually write, maybe on the whiteboard, what are the cues or the symptoms we need to listen for. So when we say, what are you feeling? And they say, fill in the blank.
Can I grab this one?
Yes, whichever marker you want. I know they're all really small, that's a really big whiteboard, but.
If women tell you, oh, I hold my breath because I feel more stable, that's a sure sign that they're not engaging their inner core correctly. And a lot of women too will start an exhale, breath hold halfway through a movement, continue into the exhale at the top. So where it feels the hardest for them, if you really pay attention, they'll listen to the cue, exhale and effort, they'll hold their breath halfway through, and then they'll continue to exhale at the top. And we wanted to get them to kind of do that exhale clear throughout the movement. So that's another pressure management issue when you see people doing things like that. Have this hump coming out. The other part of that is it also can invaginate, or it can sink in. So it looks like the abdominal wall is sinking into the body. It's another issue with pressure management. So you can have stress incontinence, which is obviously not mental stress, but the stress of the pressure pushing down on the bladder. You can have urge incontinence, where you get that really strong urge to go to the bathroom, or you can have mixed incontinence. A lot of women have a combination of both of those types of symptoms, where they get the urge and they leak with pressure management issue. And if a woman says, something doesn't feel right, there's something when I look at my vaginal opening that doesn't look right, or if they're sexually active again and they say, my husband says something is just different, it doesn't feel the same, something's not right there, those organ systems, they drop, and when they drop, it can create all kinds of different symptoms. So feeling of pressure can either be prolapse, or it can be that they're holding their pelvic floor too tight. A lot of the times when they go to their doctor and they tell their doctor they have back pain or that they have pubic joint pain, a lot of times the doctor will say, you're pregnant, give it, another few months and you're going to deliver and you'll be fine. There's so many things that we can do during the pregnancy to keep women working out, because a lot of times those kinds of things will stop women from coming in and working out. If you had a shoulder injury and you went to your doctor, you went to a physical therapist, are they going to touch your shoulder? Are they going to make you move it? Are they going to try to figure out where that problem's coming from? The answer is yes. But the only way that we can really assess the pelvic floor is to do a pelvic assessment. But our job too is to help you guys flourish as a business. We want to refer people to you all, And when you have male clients here who say their wife is pregnant, that should be like your cue to be like, hey, she should be coming in here, and she should be coming in here because it's going to help her through the delivery process. It's going to help the baby through the delivery process. So our job is to really kind of help you guys. Plus, it's really good for the husband and the wife to be able to come in together and have that bonding.
All right. Hopefully you guys really enjoyed listening to Julia and Amy talk about pelvic floor physical therapy and how the pelvic floor is extremely important in breathing and recovery and making sure that you're lifting appropriately when you're going back to exercise. For more information about Restore Your Core PT, make sure you head down into the description. I'm gonna link their website and some of their social media accounts so that you can reach out to them directly with any types of questions that you may have about this particular topic. Ask them any questions that you might have related to yourself and your health so that you can make sure that you're on the right path towards achieving your fitness goals and doing it safely. If you got a lot of value out of today's video and out of listening to Amy and Julia talk, make sure you leave a comment down below. Let me know what you're doing to aid in your recovery from having a baby, and if you're postpartum or if you're pregnant, what are the things that you're doing to help yourself in your fitness journey? Thank you guys so much for watching today's video. As always, if you enjoyed it, please do me a favor and hit that like button. It really helps the channel grow and reach more people. And for more videos like this, make sure you click over here. And until next time, go out, do good things, and don't forget to move. I'll catch you later.